Good evening. My name is Randy Helm, and I'm president of Muhlenberg College. On behalf of the Muhlenberg community, I'm pleased to welcome our neighbors to campus for this town hall debate and discussion. And I'm extremely proud of our college Democrats and our college Republicans for working with the candidates to sponsor this event. Muhlenberg College is committed to dialogue and debate on the important questions that face our country. And few questions are more important than that of whether health care is a fundamental right for all citizens, and if so, how that right can best be guaranteed. I'm pleased to welcome Representative Sestak and former Representative Toomey to Muhlenberg for this discussion, and to turn the lectern over to Professor Chris Borick, Director of the Muhlenberg Polling Institute. Thank you for coming tonight.
Thank you, President Helm. We appreciate your generosity in opening up the college for this very important event. As all individuals in this room are well aware, the nation is in the midst of a great debate regarding the future of the healthcare system in America. While almost everyone agrees that there are major issues that threaten the quality, affordability, and accessibility of healthcare in this country, there is significant disagreement on which is the best path to take to improve the important facet of American life. Tonight, two men who seek to represent the Commonwealth of Pennsylvania in the United States Senate have agreed to share their views on this issue of health care and to answer your questions regarding this subject. Before I have the pleasure of introducing these two gentlemen to you, I will take a few moments to discuss the rules that will govern tonight's discourse. The event will start with short opening remarks by both candidates. After these opening remarks, I will open the forum to questions from the floor. I will ask a question, or to ask a question, simply raise your hand, and I will select individuals to participate. I will alternate selections between each side of the room. If I select you, please move to the aisle where one of our students will hold the microphone for you while you ask the question. To help maximize the number of questions asked, I will start the evening by picking a questioner from both sides of the room, with one participant asking a question and the other waiting on deck. When you ask a question this evening, please direct the question to both candidates. Direct to both candidates here. Try to be as clear and concise as you can with your question so we can hear from as many people as possible. Each candidate will have a maximum of 3 minutes to answer the questions posed to them, and we'll have a timer that will give cue cards to say that the time is running out. Please realize that there are almost 400 people here tonight, so most of you will not have a chance to ask a question to the two congressmen. It's extremely important that the discussion we have here tonight remains civil and productive. Discourse is the lifeblood of a democracy, but it involves both talking and listening. Please be respectful of both your fellow citizens that are here tonight and the candidates by holding all applause until the forum is over. You'll have a great chance at that point to applaud for the candidates. And last but not least, if you haven't had a chance yet to turn off those cell phones, please do now. Now let me introduce our candidates who are here tonight. Joe Sestak was elected to Congress in 2006 to represent the 7th Congressional District. He had a 31-year career in the United States Navy, attaining the rank of a 3-star admiral and serving in the White House, Pentagon, and in operational commands at sea. He attended the United States Naval Academy and later earned a PhD in political economy and government from Harvard University. He resides in Delaware County with his wife Susan and daughter Alex. Pat Toomey was elected to Congress in 1988 and served 3 terms as the representative from the 15th District. Before serving in Congress, he was a small business owner running a family-owned restaurant chain along with his brothers. Most recently, he served as president of the Club for Growth, a limited government free enterprise advocacy organization. He is a graduate of Harvard University and resides in Zionsville, Pennsylvania, with his wife, Chris, and their 2 children. Would you please join me in welcoming Congressman Sestak and Congressman Toomey to Muhlenberg College? Congressman, thank you very much. Per a coin flip before the event started, Congressman Sestak will lead off with opening remarks tonight. So Congressman Sestak, the floor is yours.
Thank you very much. Muhlenberg College, thanks for hosting this, and Chris, thanks for moderating it, and to you, Pat, thanks for accepting my self-invitation to come up to your beautiful hometown and have a debate, a civil discussion of an idea that is of such great moment for our country at this time: health care, affordable, accessible health care for everyone. When I joined the military many decades ago, I spent the following years actually defending this electoral process, where I believe the civil discussion of differences of opinion, stark as they might be, can actually be held, and then the voters choose. But I also learned something else in the military: how well they invested in us. When I went off to 11 months for the war, my daughter and my wife were covered in health care. And the dividends was I was focused on the mission. And then 4 summers ago, when my 4-year-old, my only daughter, was struck with the same brain cancer that Senator Kennedy has, I was very fortunate. I had TRICARE. We had an opportunity to save her. So I entered politics about 3 years ago for one purpose, one mission. Every father, every daughter, every wife should have that same opportunity for their children. Everyone should. Tonight we'll have a difference of opinion how we both want to try to achieve that. I believe that Pat, with his good intentions, however, will just continue to have the insurance companies decide how to ration our care, how they will set the requirements, how they will dictate the prices, denying coverage to those who have pre-existing conditions. I believe in a system that the reform will make sure that it's dependent upon the marketplace, where once again we can restore fair, competitive bidding, so that everyone has the opportunity to retain what you have in an affordable way, and everyone can have health care. So tonight, I thank you again for being here and for listening to us present our ideas on how best America can achieve this and then come together. Thank you.
Thank you, Congressman Sestak. Congressman Toomey.
Thanks very much, Chris. And first, let me thank Muhlenberg also for hosting this. It's great to be back here at Muhlenberg. Joe, thanks for being here, and welcome to Allentown. The old Queen City's delighted to have you here. And beer's on me afterwards when we go out for one. I think this is an important opportunity, and it's unusual. In fact, to my knowledge, this is the first time in our country that 2 members of different parties with very differing views have come together to have this kind of discussion about an issue that's clearly so important to all of us. Let me start by saying I think there are serious problems with health care in America, in particular the way we pay for it. Healthcare costs they're too high. They're escalating too rapidly. It's a huge burden on a lot of individuals and a lot of businesses. And that's a problem. We need to address it. Access to healthcare is also a real problem. There are people who, for a variety of reasons, have a real problem getting healthcare that's affordable and works for them. And we've got to deal with that too. Now, I support a number of common sense bipartisan reforms that will help dealing with those problems, help deal with the cost, and help improve the access. And I hope we can reach a consensus and get to those kinds of reforms. But what I can't support is this gigantic 1,000-page bill that is really just chock full of all kinds of new big government mandates, mandates on employers, mandates on individuals, mandates on insurers, over $1 trillion of new spending at a time when we can't afford it. Huge new taxes, taxes on workers, taxes on employers, taxes on business, and a dynamic that's guaranteed to cost some people their jobs and cause other people to lose the private health care coverage that they're happy with. That's not the right approach, and I can't support that. You know, we shouldn't rush into remaking 1/6 of our economy. Let's take our time. Let's do this right. Thanks very much.
Thank you, Congressman Toomey, and thank you, Congressman Sestak. Now, the floor is going to be turned over to you. Do I have someone on this side of the room that would like to ask a question? Ma'am, in the, yep, you? Sorry. If you could slide over. And someone from this side of the room. The gentleman in the yellow hat, or golden hat, and you'll get next. Please introduce yourself with your name and where you're from, ma'am.
Hi, I'm Fiona Sweeney, and I'm from Bethlehem, PA, although I grew up in Dublin, Ireland. And I want to ask, would it be possible to model the healthcare industry after the auto industry and put it out onto the free market and move it away from employment? I think by doing that, you would increase entrepreneurialism and increase employment, you know, which is a serious problem. I see healthcare as restricting free enterprise and people from starting up their own businesses and employing more people. Thank you.
Thank you, ma'am. Congressman Sestak, you'll go first for this question.
Yes, but may I ask, you wanted it, I'm sorry, I lost some hearing in the Navy. Healthcare. Can you just repeat the question, the portion about putting it on the, taking it away from the employer? Is that what you're saying?
Yes.
Okay, got it.
Yeah.
I just couldn't hear it. Thank you. No, I don't agree with that. And let me tell you why. In this bill that we're working through Congress, we actually want employers to keep their health care for their employees. Why? Well, we think it's best because the system isn't completely broken. What's broken is that the insurance companies are able to dictate what the level of requirements that those who want health care can have. And what we do in this bill actually is say, employers, we want you to keep your employees covered. If you have a payroll less than $500,000, you don't have to. But above that, you have to keep it. And we do that by incentivizing them. They get a tax benefit by having health care for their employees. And I think that is the best way to go. What the real dramatic change in our plan, however, which really gets lower cost is this. For far too long, as the Department of Justice criteria has demonstrated, that over 90% of our insurance markets are in what is known as highly regulated insurance markets, which means there's no competitive pricing. Take Pennsylvania. There's 2 large corporations that have 70% of all the private health care plans. It's like OPEC. It's like a cartel. And they can dictate a price. In fact, imagine being an individual going up against one of those 2 corporations for a fair pricing. So what we do is say, keep your health care plan. But we're going to put another health care plan out there. Call it whatever you want. It's not going to be subsidized by the U.S. government, however. It's going to be like Blue Cross Blue Shield was 5 decades ago. It is actually going to have to live or die on the premiums, the co-pays, and the deductibles of those who elect. You don't have to, but elect to join it. And only those in companies with less than 50 employees or individuals can elect to join it or join any other private health care plan out there. The difference of this public option, public because Joe Public can join it as a choice, is that we're not going to pay $20 million salaries to the CEO, or as happened in Pennsylvania, $70 million severance pay, large advertising cost, or having a lot of accountants that, how much time? Pardon? Oh, that can actually, and I'll conclude here, so that you begin to get competition once again in the marketplace. That's the concept that I believe will best have affordable health care for everyone. Thank you.
Thank you. Thank you. That's okay. It's hard to see. Congressman Toomey.
It's a great question because it goes very much to the heart of what's gone wrong with the way we pay for health care in America. When you think about it, it's actually quite unusual. We expect from our employers to be paid wages for our work, and we get paid. We don't expect our employer to provide our house for us, or to provide us with a car, or to provide homeowners insurance or automobile insurance, but we get health insurance from our employers, instead of getting the money with which we could go out and buy it ourselves, like we do for every other service and good that we buy. So you might ask, well, why do we have that situation? There's a reason. This is a relic of a misguided policy that the government imposed back in World War II. In World War II, the government imposed wage and price controls in, as I say, a misguided effort to deal with escalating prices. Employers had a real problem attracting workers they needed because they couldn't give them a raise. It was illegal. So what they did instead was they gave them health care benefits. It took a little while, but eventually Congress caught on to what was going on and discovered that people were getting these health care benefits. So they said, well, we got to tax it because that's a form of income. But by then it was so prevalent already that there was an outcry, and people didn't want any part of having to pay the new tax. And so Congress backed off, and to this day, we have this unusual situation where there's this one product or service that an employer can provide a worker. It's not taxable to the worker, and it is tax deductible to the employer. And so there's this huge economic incentive for employers that can to provide health insurance for their workers. It's just more economically efficient than giving money, and so we have it. Now, I have to tell you, I believe that this dominance on third-party payers, in the case of someone who's getting their health insurance from the employer, it's their employer who's the third party paying the bill. In many other cases, it's the government. But this really separates the role of the consumer and the patient. And it creates lots of unintended consequences and problems. One obvious one is most of us don't get to choose our health care plan. Our employer chooses it for us. This is one of the big problems. If we go down this road of creating a public option, a government-run plan, this is designed so that it will be a low-cost plan. The reimbursement rates are designed to be lower than private plan reimbursement rates, so it's going to be, it's really not going to compete on a level playing field with real private plans. But if we go down that road and we introduce this, it's going to create an incentive for employers to drop their coverage. And, you know, Joe suggests that this is our choice, whether or not to participate. Well, not really. Because for most of us, it's our employer's choice. And a lot of employers are going to make a rational decision if this bill is passed in its current form. They're going to make a rational decision to drop their coverage. And that's going to force people onto this government plan. I don't think we should go down this road. I think we should instead work towards creating a dynamic market for individuals. Allow individuals to get the same tax treatment their employer gets. So people could buy plans that work for them and their family. They'd have more choices, more options. It would suit their needs better, and we wouldn't be as dominated as we are by this third-party payer model.
Thank you. All right. I'm going to put somebody on deck from this side of the room. The gentleman in the blue shirt, yep, if you want to come down. And, sir, it's now your question.
My name's Roy Chrisman. I'm from Carbon County. I have a question about tort reform. I've heard that tort reform could lower medical costs or keep them in check, and yet I've also heard that in areas like Dallas or Brownsville, in a state that passed tort reform, medical costs continue to rise rapidly. And my question is tort reform enough?
Thank you, sir. Congressman Toomey, you'll have the first crack at this one.
You know, I don't think tort reform is sufficient for the problems that we face with health care, but I think it has to be in the mix. Because I do think we have many, many examples of abuse of our legal system, and that does contribute significantly to cost in several ways. But let me be clear about what most of us mean by tort reform. First of all, nobody I know who advocates tort reform has ever suggested that a person who suffers from a negligent act by a physician or a hospital shouldn't be fully compensated for the cost of further health care that arises from that error. And no one's ever suggested that they shouldn't be able to recover all lost wages. So basically, all economic consequences of any kind of healthcare negligence should be fully reimbursed with no cap. But many of us have argued, and myself included, that we ought to put a cap on the pain and suffering number, that subjective number that sometimes juries hand out like it's a lottery. Sometimes it's multi-million-dollar awards, and it is devastating. The cost is not just the direct cost that doctors and hospitals pay in medical malpractice insurance and legal bills, but it includes the cost of practicing defensive medicine. I mean, I've talked to a lot of doctors, and they may not really want to, say this publicly, but they will say candidly that because of the risk of being sued, they often will order services and tests and procedures that aren't really necessary, but they do it to cover their own risk. That is a huge built-in cost that we have on our system, and we could address that. As I say, it's not the whole solution, but it's part of it. And let me just conclude by saying I think the data is pretty clear in states like Texas, where they have implemented tort reform. They have had, yes, healthcare costs have still risen, but not nearly as fast as they've risen in other places. One last point, since I don't seem to be out of time yet. Another big part of tort reform is access. It's not just about the money, but if you look in Pennsylvania, we have lost doctors. Over the last decade or so, we actually have fewer doctors today than we did before. That can't make sense. That can't be right. In survey after survey, when you do interviews of residents, the bright young men and women who are just coming out of medical school and doing their training, they come to Pennsylvania because we have some of the best training hospitals in the world. And then they leave. And they have cited in surveys that the cost of medical malpractice is part of the reason that they leave. Don't be fooled by the fact that some would suggest that it's a small percentage of total healthcare costs. The problem is concentrated in certain specialties. It may be true that it's not a big concern for, I don't know, maybe dentists, maybe general practitioners. But if you're delivering babies, if you're doing neurosurgery, if you're doing orthopedic work, it's a huge problem, and it's driving doctors out of Pennsylvania. It is a cost to our system, and it is discouraging people from entering the field of medicine. I want to see the best and brightest kids in our colleges still go to medical school, still want to be doctors, and I don't think we should be inhibiting them this way.
None of us want frivolous lawsuits. We have wonderful doctors. They saved my daughter's life. One study said, actually, that 3 out of every 4 lawsuits that are brought forward are fraudulent. That same study said, however, that only 1 out of every 10 studies that legitimately could be brought forward is ever brought forward. Now, the Government Accounting Office and the Congressional Budget Office have done 3 studies on this. And the conclusion is that the cost to health care from litigation is half of 1%. Now, the bill does address the other 99.5%. And the reason that 0.5% is not included is, well, I honestly believe every person is permitted their day in court. I can remember 5 decades ago when my mom had a probe put down into her stomach through her throat. They pulled it out 10 minutes later, and she never tasted it again. But she's the older generation, and it wasn't life-threatening, so of course she didn't sue. And as Pat said, yes, I do understand having economic livelihoods. As a young boy, 6 years old, through malpractice somehow becomes a quadriplegic. And that we should recover, as you said, his livelihood that has been lost. But that boy will never walk again, go to the bathroom by himself again, or put his arm around a girlfriend at 18 years old. And I don't think it's incorrect to say you should have your day in court. It's what the Constitution says. I don't want the government to intervene and think the government is wise enough to say it should be $250,000. I want a jury of your peers to decide that. The GAO also finished a study where the AMA said, there may be some defensive measures being taken. But they, with the GAO, concluded that they could not find evidence of statistical worth. And the Government Accounting Office then said, in fact, it appears as though, not for avoiding litigation, that's 1 minute, but in order to enhance the revenues, according to the GAO, many of these extra tests are being done. So as you sit back and you see that those states that actually have caps have actually, per 100,000 population, approximately 50 less physicians than do those who have no caps, it begins to say, wait a moment, maybe that person deserves their day in court. And the federal government is not wise enough to say, this is what it's worth. That's what I believe. Thank you.
All right, I'm going to take someone from the left side of the room. Let's see, the gentleman in the, I think it's a tan sports coat. Yep, you'll be on deck. And sir, could you please introduce yourself and where you're from?
Jake Oberholzer from Allentown, Pennsylvania. My question is, what can we learn from other countries, specifically industrialized nations in Europe and Asia, that appear to have statistically better results, both in the quality of care and also in the level of cost, and how can we bring the best practices that they've developed in their healthcare system?
Cost we do from our drugs, from the same pharmaceuticals, and then we're forbidden to re-import them? I don't understand that system. So I ultimately believe that competition, but fairness and transparency in that competition will best discipline cost. Look, we saw what happened, however, when you let companies or corporations determine the rules. That's what we did in Wall Street. We said, you don't need regulation, figure it out yourself. Now look at your IRAs and your 401s as they just flip-flop back derivatives. So I'm saying, wait a moment here. The real change that I learned going around is saying, there's some real goodness in competition. It's going to find the drug, the next drug for my daughter, as one doctor said. Get her down 5 years, and we'll find the next one for another 5. I want that entrepreneurship to be a norm, not an exception. And that's why competition is important. But unfortunately, take the Philadelphia media market. 42% of the population lives there. One company has 70% of all the private healthcare plans and dictates the prices. If you're a woman, most women, a lot of women, more than men, work part-time. Employers don't give you health insurance if you're part-time, so they have to go in the individual insurance market. And do you know the majority, the vast majority of individual health plans deny maternity services? What's she gonna do? I think there needs to be a fair referee on the football field, like we didn't have in Wall Street, but rely upon competition once again to lower the premiums. The premiums of Pennsylvania have seen doubled in the last 8 years as we did nothing, and just let a cartel, by and large, dictate the prices. So that's what we do. Again, there's certain requirements. We want people to get a mammogram, a woman. So we catch it early, both for health, and we'll pay less over time if we catch it early before it spreads everywhere and it's more costly. And then that public option, a choice. And by the way, there was an amendment that did change it, Pat, that actually said, no, it's not Medicare. It has to compete on the market when it goes to a hospital and says, I've got some patients. How much will you pay me in the rate for them? It's got to succeed in the market. But again, it doesn't pay the high administrative costs. CBO says it's about 10% less, and we begin to get fairer prices. Thank you.
I know there was an amendment that was passed in a committee that did say that the reimbursement levels under the government plan would have to compete in the market. But that wasn't your committee, Joe. That passed a different committee. Your committee passed the bill that specifies that the government plan will reimburse at Medicare rates, which is 20 to 30% below what private plans reimburse healthcare providers at. You voted for that bill, and we don't yet know which version is going to be the one that will finally be on the House floor and finally be considered for final passage. But there's another thing. I know you talked about the idea of having competition and using the markets, but there are features in this bill that make that impossible. There's another amendment that passed in your committee. This was the amendment. It was offered by Dennis Kucinich. Some of you may remember Dennis Kucinich's campaign for president. There you go. Dennis is a self-avowed socialist, and Dennis is not very fond of free enterprise and competition generally. And he offered an amendment that says if a state wants to, a state can ban private insurance altogether. Now, Joe voted against the amendment, but the amendment passed. The amendment passed and became part of the bill. And then Joe voted for the bill. So, again, we don't know which version of this bill is actually going to be signed into law, if any. But we do know that one of the major House committees, with Joe's vote, passed a version of the bill that would allow states to ban private insurance. I think that's pretty extreme. That's pretty radical. And not only that, I mean, today, President Obama, the administration, not the president in his own words, we'll have to wait a few more days to hear that, but the administration has indicated that they're backing away from the government option. They're going to back away from that. They realize that this has lost tremendous whatever support it might have had. There's a Democratic senator that came out today. She opposes it too. So I think we're probably going to avoid some of the worst features of this bill. But it's very worrisome when you look at some of the products that's coming out of those committees. To address the specifics of the question about healthcare in other countries, there are occasionally studies, but I think they're misleading, frankly, if they try to suggest that healthcare services are better generally in any other country in the world. Just ask yourself, when a very wealthy or a head of state of a foreign country is seriously ill, where do they come for treatment? They come to the United States. The fact is, countries that have gone down the road of socializing medicine, and there are many of them, right? Many in Europe, Canada, they all have very, very serious chronic problems of rationing health care. In the UK, it's downright chilling. They have a commission that decides who gets health care and under what circumstances. That's what has to happen when the government runs the show. And they've gone so far as to decide that 6 months of life is worth $23,000. And so if you are facing an illness that could take your life and they think that the treatment is going to give you another 6 months, they're willing to spend $23,000 on it, but no more. That's pretty chilling. In Canada, you know the old joke, right? The reason America can't have a socialist healthcare system? What would the Canadians do, right? I mean, there's a huge number of Canadians who come to this country for healthcare.
Please. Ladies and gentlemen, wait till the congressmen have finished before you applaud.
And we know a little bit from personal experience in my campaign. We had a young fellow working for us this summer named Dan, a great kid, bright kid. He happens to attend McGill in Montreal. He went back to school a couple of weeks ago, and his folks called a physician friend of theirs because they wanted to make sure there was a general practitioner who would see him in case he needed some kind of health care over the course of the
Congressman, we're out of time on this question.
The doctor reported there are no available GPs taking new patients in Montreal.
Thank you. Let's see. We'll get somebody from this side of the room. The woman in the white shirt next to the aisle. Thank you, ma'am. Sir, could you please introduce yourself and where you're from?
Professor Shore, Ron Schegler from Hellertown, Pennsylvania, the joys of small-town America right here in the Lehigh Valley. And I guess we're in the postseason of the August town halls here tonight. A couple of related questions, and I don't think the two of you gentlemen could get away tonight without answering this one that's always been at the town halls. Have you read the bill? And I know Congressman Toomey's kind of hinted at this. He brought it along with him. And then what is the cost of the bill? And especially Congressman Sestak, you've been very clear, of late, and you've been holding up, the zero. And you've also referenced the Congressional Budget Office on tort reform issues. Yet the Congressional Budget Office has said that in the first year, this bill will cost, if passed, $239 billion. And as Congressman Toomey said, over the next several years, between $1 and $1.5 trillion. So how do you reconcile this difference between zero and up to $1.5 trillion? And could you name, either of you, could you name any federal program of consequence that costs nothing?
Okay, Congressman, do you feel you want to take a crack at it, or do you want it clarified? No, I just want to know if it was clear enough, the question? Yeah, it's clear. It was clear.
I think it's an important question. Let's look at where we are. In just the last year, less than a year, we've spent over $700 billion bailing out failed financial institutions. We've partially nationalized a number of banks. We've fully nationalized AIG. We spent $200 billion nationalizing Fannie Mae and Freddie Mac. We spent a couple of $100 billion nationalizing the car companies. We put the taxpayers on the hook for $5 trillion in contingent liabilities by forcing taxpayers to guarantee assets on the balance sheets of Fannie Mae and Freddie Mac. We passed an over $800 billion so-called stimulus bill. Then they passed a budget that is $3.6 trillion. This year alone, the budget deficit is going to exceed $1.6 trillion. By way of context, last year a lot of folks were really upset when the budget deficit hit a record of $460 billion. Now it's $1.6 trillion. Next year will be about the same. The fact is, the Obama administration released new numbers. Over the next 10 years, the deficit, the sum total of all the annual deficits over those 10 years, is going to be $9 trillion. Now, just so that you know, that's more than all the deficits we ran in the first 233 years of our country's history, from George Washington and through last year. That's a staggering amount of debt. I will tell you, I don't believe it's economically sustainable. And that's before this health care bill. So on top of all that now, they want to spend $1 trillion. That's what the Congressional Budget Office, which is controlled by the Democrats, and they crunch the numbers. This bill is a little over $1 trillion over the next 10 years, and costs after that accelerate. They don't bend the curve on Medicare, on health care costs generally, according to the head of the CBO, Congressional Budget Office. In his testimony before Congress, when asked, he said, no, actually, the curve rises. The curve meaning a graph of future projected costs. It actually goes up. Now, the cost is over $1 trillion. Now, they pay for part of that with huge tax increases. There will be taxes on S corporations, small businesses. There will be taxes on individuals. There will be wage taxes on employers who can't provide health insurance for their workers. They'll be penalized with an 8%. Let me just reflect on that for a minute, because I think that is one of the truly worrisome things that's going on here. We have a tax code that provides an economic incentive to provide health care for their workers. And so most businesses do, and the only ones that don't are those that can't afford to. They operate on margins that are too tight. And what we're going to do at this time, in this economic environment, we're going to punish those firms with a new 8% tax on all their wages. Now, they wrote into the bill, you can't cut people's pay rates just because we're hitting you with a new 8% tax on their wages. So they won't do that. They'll lay workers off. And that's what's going to happen here. See, I just think this is the wrong direction. There are things we could be doing to lower costs. We could allow people to buy health insurance plans regulated by other states. Joe says he wants competition, but he doesn't support a measure which would allow us to open up the whole country so that Pennsylvania families get to decide. Do we want a health care plan regulated by Pennsylvania, which, by the way, forces me or any of us to pay for chiropractic care whether we want it or not? Or do we want a plan that's regulated by a state that might have fewer mandates, might have a lower cost? I think there are things we can do, things we need to do, but we don't need to spend $1 trillion of money we don't have and saddle our kids with debt that they can't afford. Okay.
I think the first question was, did I read the bill? Yes, it's the sole reason I went to Congress. Second of all, let's talk about the $1 trillion. I wasn't in Congress when Pat was, and if you don't mind, Pat, I think just to make sure we can compare, I really like what President Clinton had done with the Republican Congress, to where they had 3 consecutive budgets that had surpluses because they had a pay-as-you-go agreement. And then Congress, in 2001 with the Bush administration, voted to get rid of it. And that $4.5 trillion debt, as you were in Congress, well, by the time President Obama took over, it was $11 trillion. It's pretty hard to splash water when you're the one who put it in the bathtub. That's a lot of debt.
Please, ladies and
So
gentlemen,
my
wait
only
till
case
this
is,
speaks.
if I could, Pat.
Go ahead.
Okay, I'm sorry. So if I could, on that debt, yes, we have to address it. And that's why I voted again for a pay-as-you-go government. And that's why the CBO said the bill that's in the House is budget neutral. It doesn't add a cent to the debt.
Please.
Did I part my hair on the wrong side? And so the CBO said, yep, it doesn't add a cent to the debt. The $239 billion that you mentioned was outside of the health care reform bill. Every year, Medicare cuts doctors' physicians' pay. Last year, it was by 11%. This year, they cut it 21%, and the doctors were walking out. So we found the revenues, and we found the savings that CBO scored it at budget neutral, except for what would have happened anyway with that. And so we did do this in a very fiscally conservative way, but what really happened over the last 8 years is nothing occurred, was the following. Did the cost go up? Yes. Your premiums in Pennsylvania went up 100%. Every day, 14,000 Americans lose their health care as we do nothing. That's the equivalent by next Wednesday of Allentown. Everybody losing their health care. So there are those who want to provide leadership, and we may disagree, but the issue here is, do we accept the system that gave us 14,000 Americans losing their health care every day, or do we actually step forward and say, let's look at the facts? And the facts are that we have to retain the market-based system. But to do that, you need this option out there that begins to give them fair competition. Second, we lose $100 billion a year in economic productivity because of the uninsured. And because of our less healthy population, $250 billion a year. This is the right thing to do, but it's one of those cases where the moral thing to do is also economically necessary. Thank you.
Thank you. All right, I'm going to pick someone on deck from this side of the room. Let's see, we haven't gone down that gentleman. All right, you'll go up on deck, sir. Ma'am, please introduce yourself and tell us where you're from.
I'm Patricia Bristol. I'm from Bartow, Washington Township, Berks County. I have a vested interest in health care and the reform that goes along with that. I am currently undergoing treatment for ovarian cancer, and ironically, I am an oncology nurse for the last 30 years. I've seen both sides of this. I think there's one thing I've not seen addressed in any health care reform is when someone is eligible for Social Security disability, it takes 2 years to be eligible for Medicare, and that is a lapse of time. And a lapse of time prevents some people from going on disability, and they struggle to work to keep their health care insurance. That should not be. I am part of the Ovarian Cancer National Alliance, and part of that we have a message board, which is worldwide. We discuss things about our treatment, doctors, etc. Many of the issues involved in our message board are those who lack health care or have limited health care insurance, so they're prevented from some treatments. So there is rationing in this country. Many of these women bring us to tears when we read their messages. They have bill collectors dogging them night and day. They can't go for treatment because they don't have health care insurance or they're limited. Women worldwide are on this message board. Some are from Western countries that have nationalized health care. And unlike the scare tactics that's been talked about tonight and before, they are very happy with their health care. We message people from Australia, Canada, UK, France, Germany, you name it. They feel sorry for our women because our lack of health care and the agony they go through. What can I tell my people on the message board tomorrow? What you two gentlemen can do to help relieve their problems, financial problems, and their worries so they can take care of their bodies and get their therapy.
Okay, thank you. Yes.
Thank you for your service. After I lived in an oncology ward, I likened nurses to like chiefs on a Navy ship. You keep the seams from opening in a hospital. Thank you. You remind me of a person who came into my constituency office. She had cervical cancer, and she asked us to assist her because the insurance company had denied her the chemotherapy that her doctor, the bureaucrat in the insurance company, denied her the chemotherapy for it. So what this bill does that we're working so hard on is does the following. We say to all the health care plans that you must no longer deny maternity services for women. We also say you can no longer discriminate against women who pay more than men. You must be equal. We also say that your preventive care, co-pays for everyone, including seniors, is free because we want you to come in. We want you to get and find out, did you have cervical cancer? Do you have breast cancer early? Because 98% of the women we catch it early survive, but also we pay less as a nation if we do that. I just held a Women's Healthcare Summit on Sunday for women at Brandmore University for this issue. And I'm happy to send you everything that we passed out there. But I'll never forget the businesswoman who stood up and said, I'm in my young 50s. 10 years ago, I got cancer, and I can no longer get health insurance. And I'm a successful small business owner. The system has to change. Why are insurance companies rationing our care? And you're right, other countries do what's good for them. But when we have a nation that's 37th in infant mortality, America, we're better than that. We have quality nurses, we have quality doctors. People just can't get access to it. And so people talk about requirements. Yes, we can deregulate and let state people in Pennsylvania, citizens, buy in Alabama or Georgia. But here's what happens. As the United States president of the National Association of Commissioners said, it'll be a race to the bottom. People, headquarters are domiciled in a place like Alabama. And when you have a problem, take it up with a commissioner in Alabama, not here. They'll put a headquarters in a place like states do that have no appeal process. And they'll put it in a place where maternity services aren't required. And then they'll cherry pick the rich and the healthy. We are a less productive economy unless we get health care for all. Why does our military give us all health care? The dividends and the productivity as we go forward. This nation has to compete again. And when a small business today is paying 18% tax more than a larger business for their health care, because that's what it costs them because they can't spread the risk, we've got to reform the system. And that's why I went to Congress for. Thanks for your service.
Joe mentioned a statistic about being 37th in the nation in infant mortality. I thought you said 37 or thereabouts in the world. It's the government-run program of Medicaid that's at the bottom of the list. People who are not in the government-run program do much better. I think we should be careful. I think we should be careful about...
Ladies and gentlemen, please let him speak.
I think we should be very careful about assuming that the only way we can have competition is with the government running a business. I can't think of any other area where we think that. Do we believe, for instance, that we can't have competitive grocery stores unless there's a government grocery store? Do we think we need a government gas stations and home builders and farms? I mean, why is it that every other aspect of our society, every other service we need, we do quite well in the private sector? Actually, those areas where the government does play a role, quite often, we have our share of problems. This is why I believe that competition is absolutely essential. There's no question there are people who don't have access to the health care they need. I understand that. That is true. And we need to do something about it. But one of the things we can do is lower the costs. And competition breeds lower costs. We have too much concentration in Pennsylvania. There's too few insurers that provide too much coverage. If we opened up the borders, this idea of a race to the bottom is baffling to me. I mean, we have all kinds of competition in all kinds of industries all across the country. Now, I was in the private sector. I had a little restaurant business. I understand how that works. When you're in business, you try really hard to get more customers, unless the government gives you a monopoly. And what the government is doing now, and all over, is it's restricting competition and creating something similar to a monopoly. That leads to higher costs and lower quality care. So I think the kind of reforms that we're talking about, opening up for more competition, giving consumers more choices that will bring costs down, allowing deductibility on the part of workers, the same deductibility that their employer gets, that brings costs down. Tort reform is an important part of this. All of these things will bring costs down. Some people have pre-existing conditions. And this, of course, is an artifact of the employer-based system, right? If you have private health insurance, it's required that it be renewable. So if you develop an illness, that policy still has to be renewed. If you're with your employer, the employer plan is usually continued as long as you work for that employer. The problem is if you work somewhere, you have insurance, develop an illness, and then lose your job. Then there's a real problem. And I think we ought to develop a product that will allow people to insure against that risk, allow corporations to deduct the cost, but make sure that the worker owns it. So if they do lose their job, they've got that built-in insurance against escalating insurance premiums. These are things that we can do that allow patients to be in control of their own health care decisions, allow patients and families to make decisions to buy a plan that works for them. And I just think that's a much better road than the road that some other countries have gone down where the government makes all those calls. I mean, this bill creates 53 different government panels and sets of bureaucrats, all of whom exist for the purpose of deciding what kind of care will be reimbursed, under what circumstances, and at what rate. That's putting a bureaucrat between the patient and the doctor, and I just don't think that's a good idea.
All right, we're going to get somebody on deck from, let's see, maybe up in the upper corner. I haven't seen anybody. The gentleman with the stripe, I think it's a striped shirt or plaid. Thank you. You'll be on deck. Sir, please introduce yourself.
Thank you very much. My name is Tony DiPolito. I'm a colon and rectal surgeon. I've been in the Lehigh Valley for 23 years. And just if I may set the record straight, I take care of colon cancer. Neither myself nor the 3 hospital systems that I work in have ever denied a patient treatment, ever. So, my question is, my concern here is once the government or the public system comes into play, there's going to be a margin between what the government pays. I think Pat suggested earlier, that's going to be lower payment to the physicians than that is currently paid by the commercial insurances. Now, when the physicians' salaries go lower and their malpractice rates continue to climb, I understand, is there something in that bill? I'm a solo practitioner. I think that, is it a fact that solo practice, private practice, it's going to be the death of it? And I think right now, I mean, I'm looking into the future. I know I have multiple questions in this. What is going to happen with the young people coming out of medical school, right? Is there something in this bill? I understand there may be something in this bill for a national health service. Is this what we want? This is more government hiring physicians to work in their public system. So how do you mix socialism and capitalism? My question.
Thank you. Congressman Toomey, you can go first.
Yeah, let me just walk through. There's a very clear and specific mechanism by which I'm really concerned there will be a very large-scale change whereby employers will drop their coverage and people with private plans will be forced into the public plan. It's not just me saying so. Now, the CBO doesn't think so. I'll tell you right now, the CBO doesn't think that's going to happen. The Lewin Group, which is hired by groups on the left and right all the time, they think it's going to happen on a huge scale. They think 56% of all Americans will end up losing their private coverage and going into the government plan if we go down this road. And let me explain the mechanism. It's pretty straightforward. Today, on average, according to the CBO, employers pay about 12% of their wage cost in providing health care. What this bill says is you employers have to keep providing health care if you have it now, unless you choose not to, in which case you'll be hit with a tax of 8%. of your wages. Now, I was in business, and I understand how it works. When times are good and things are booming, and you know, business is going great guns, you don't necessarily watch every nickel. Probably you should, but it's human nature, you don't. When times are bad, you're looking at every last dime, because sometimes it's about the survival of the business. Now, if we set up a system where employers who are currently paying on average 12% of wages for their employees' benefits, and mind you, of course, since that's the average, many are paying much more, some are paying less. But if we set up a system where you can walk away from that and say, look, I'm sorry, I can ask my employees to go on the public plan. They don't really have a choice if the employer does that, and the employer gets to save a lot of money. You're creating an incentive that virtually guarantees that that's going to happen. That's why Barney Frank, in a moment of candor, said, the thing about this bill is it takes us down the road of a single-payer model, a model where you eliminate all the private plans, as Dennis Kucinich contemplates in his amendment that passed in the bill that came out of Joe's committee, would allow states to explicitly ban them. But rather than do that, generally speaking, what this approach does is it does it more indirectly. Now, this is a huge problem for healthcare providers because, as the good doctor just mentioned, Medicare reimbursements are 20 to 30% lower than private plans pay. It's a fact of life in America. Private insurance subsidizes Medicare. That's a fact. Doctors and hospitals get reimbursed more money from private insurers. Ask a doctor. More money from private insurers than they get from Medicare. And as long as we have this mix where we have lots of people on the private plans, hospitals have been able to get by. Most hospitals operate on a 1 to 3% profit margin, and doctors are able to earn a living. If we have this huge exodus from the private plans to the government plan, which I think is inevitable, all healthcare providers are going to be taking a huge hit. And that has all kinds of terrible implications for our access to quality healthcare, not the least of which is it's going to discourage kids, the best and the brightest kids, from going into this very important profession.
The Lowen study, owned by one of the largest health insurance companies in the nation. I'm not surprised that they came up with the conclusion they did. In fact, it's interesting. What they said isn't even in the bill. They said all the employers are permitted to go into the private health exchange. No, only employers that have 50 or less people. Then they said, to your question directly, sir, oh, it's going to be Medicare-based. That's what the public health care plan option is going to negotiate. No. My committee said 2 years Medicare plus 5, the next year you got to compete. Whatever the doctors as providers want, that's what you got to pay, just like Blue Cross Blue Shield. But actually, he's right. The Energy and Commerce said do it immediately. That's why the CBO said in the next decade, 3 million more employees will take their employer's health care plan. And yes, 12% is what the cost, but what Pat didn't inform you of, they get to do a tax deduction then of about a third. A third of 12 gets you to 8. That's the penalty if you do not actually provide health care. But then, don't forget, the employee also negotiated a compensation package where their money is going in pre-tax. If all of a sudden you rip that out by the employer, that guy's going to want his compensation increased because he's got to go out and get his own insurance. So all of a sudden you're down to about, 3 or 4%. That's why the employers, according to the Congressional Budget Office, will keep their employees covered. It's very important. Look, at the end of the day, contrary to any types of issues that have been put forward over the last weeks, there is no mandate for what treatment will ever be given. I know the bureaucrats do that, insurance companies, but there isn't any. That public health care plan is not subsidized by any government money. Zero. It's your co-pays and premiums of those who elect to go into it. And not enough go in, it disappears. It's got to survive on its own. And sir, it's got to negotiate prices. Do we help physicians? Yes. General practitioners. Because this plan is based a bit on the Massachusetts health care plan. And what they found out in the first 2 years was there was actually a dearth. Not enough general practitioners, sir. You can see that even now. And so what it does is help tuition assistants get more of them because there's no co-pays for preventive screenings. And the most you can pay out of your pocket in the future is $5,000. And we do away with annual or lifetime caps. And you can't be denied for a pre-existing condition. But when you go in for those preventive screenings, we want to make sure that there's enough general practitioners there. And so we do incentivize them in tuition. And the Medicaid, we do raise that from 80% up to 100% equal to Medicare because it's not fair to you. And it should have been done before. Just wasn't around a couple years ago. Thank you.
All right. I'm going to get somebody from this side. So maybe someone in the back, too. Ma'am, way up in the left-hand corner. Yep.
Thank you.
Very good. Middle. We'll go middle next time. Sir, please introduce yourself.
My name is Alan McQuarrie. I live in Doylestown, Pennsylvania. And I want to ask the question, what abuses have you congressmen seen committed by private insurance companies that can be fixed, and how?
Last week, a woman came into my congressional office. We keep our office open 7 days a week. She came in. Back in January, her payments went up, $29.10. She paid the rest of her bill in January, but in this recession, she didn't have enough to pay for that 1 month alone, the $29.10. She paid the full amount in February, March, April, May, June, July. She went to the hospital for serious treatment in July, and the insurance company denied her treatment because of that $29.10. It's called rescission. And what you have in the insurance companies is where they hire accountants that when you go in for treatment 10 years later, if they find an administrative problem on your application, and sir, you're right, it's not the hospitals. They don't deny coverage, but they deny you coverage for technicality. We forbid what's called rescission. We have handled a young couple who came in with a young boy, stunted growth, and the insurance company denied it. That doctors recommended hormone treatment so it could grow. And we had to roll in and ask them to reconsider, which they did. So we do set, not rationing. We do away with rationing. The rationing that says you cannot have health care if you have a pre-existing condition. The rationing that says, look, we're only going to do these types of screenings. And so what we do is say there's just a minimum level. Do more if you want, have more choices, but every healthcare plan will have to have the same requirements that congressmen and women get, period.
Please, folks, hold your applause. You can still have some time.
Okay. Yep. The point here is that the market is good. It does give innovation. We have to preserve that. But everybody knows when you have a monopolistic type of insurance market, you've got to change that. And that's what we're trying to do. Look, the less interference the government can do, the better. But it did not have any rules on Wall Street at all. No reserves for the derivatives. And look what happened. And so my take on this is there just has to be fair play on the competitive field. And that's all we're trying to do in this case. I appreciate the question, but I do want to go back to your issue, I think. Doctors are wonderful. And if we don't get the type of proper reimbursement to them, both in Medicare and Medicaid, we can't preserve the quality of those systems. I do support those systems, and here's why. I think Hubert Humphrey said it best, that there is a moral obligation, in my opinion, to take care of those in the dawn of life, the children. S. Chip. And you know we disagree on that. I voted for it, contrary. There are those who, we should take care of those in the twilight of life, the seniors, and those in the shadows of life, the sick, the disabled, the handicapped. I do believe that. But in this case, moral is good for our economy if we get the competition fair once more. Thank you.
I think Joe has correctly identified a big part of the problem. It's a lack of competition. But he's got the wrong solution. Let me ask a question. If you have car insurance and you got into an accident and the insurance company refused to pay for the damage that was done, say, what would you do? Well, you'd probably sue them for breach of contract. And you sure wouldn't renew the policy with that insurance company, and you tell all your friends that this is a lousy company and they should never do any business. And if that car insurance company did that often enough, I promise you they would go out of business. That's the way business works. So unfortunately, we don't have a competitive market for insurance. And I think we ought to. I think we ought to have associations be able to get together, trade associations, other groups, where people could then pool their numbers and buy insurance from anywhere in the country under the auspices of whatever organization they happen to belong to. As I mentioned earlier, I think we ought to be able to buy insurance plans across state lines. That would be another way that we would have much more competition. But I've just never understood why you have to have a government-run plan in order to have competition, since we don't have it in any other aspect that I can think of. Let me tell you, there's something else that worries me about this bill. And it's something that's called, I'm looking at my notes, I want to get this right. It's the comparative effectiveness research. This is one of many of those boards and commissions and agencies that this bill would create. There's, I think, 56 of them. And, you know, there's some merit to the idea of, I think there's a lot of merit to having doctors study and learn and stay current on best practices and what's working and what treatments are out there and what the experience is. But this is a bureaucracy, a government bureaucracy, that is going to be empowered, according to the president, who has suggested this. He has suggested that doctors be financially incentivized, those are his words, to follow the recommendations of this bureaucracy. And he's also suggested that doctors should have less susceptibility to medical malpractice lawsuits if they follow those recommendations. Now, you know what concerns me about that? Healthcare is complicated. And it's personal. I think of my dad. My dad's 79 years old. My mom, she might be watching, so I'm not going to say her age. But, you know, at the age that they're at, they have multiple issues. And fortunately, they're all very manageable, and they're doing great. But there are multiple sort of complicating health issues that they deal with every day. There's nobody else in the world like my dad. No one is exactly his age and height and weight and lived the life that he has led, had the illnesses that he's had and the injuries that he's had, and had the health experience that he's had. I guarantee you there is no study that's been done that tells you exactly what the optimal treatment is for my dad. And so I want his doctor to have discretion. So this doctor should be informed by these studies. But I worry a lot if this bureaucracy is going to have the power, which it does in this bill, to create financial incentives and financial penalties for the doctor who treats my dad in a way that he thinks is best for my dad, but the study doesn't necessarily agree.
All right, I've overlooked the middle today, so let's find some, how about right from the middle? The gentleman at the, not you, the one right behind, that's you, sir, if you want to come over. Thank you. Ma'am, please introduce yourself.
My name is Mary Ann Vaught, and I'm from Upper Saucon Township. I first of all want to thank both of you gentlemen for appearing tonight. I'm very proud to be part of this presentation that you're doing, and I think it's a wonderful idea. My question is relatively simple. I'm asking for your opinions. We've been told, I believe, and forgive me if my figures are not correct, that 20% of Americans are uninsured. We have also been told that 25% of those 20% are illegal immigrants. How do you feel about including illegal immigrants in this healthcare system? Thank you.
That's okay.
Okay, I'm going to refer to some notes here because there's a lot of numbers. The number that we hear most frequently suggested about the number of uninsured Americans is something like 45 million, 46 million, right? We hear that very frequently. What we seldom hear is that according to the Congressional Budget Office, 45% of the uninsured people will be insured within 4 months. So for most people, this is a very temporary phenomenon. That doesn't mean it's not important, but that's context that we ought to have. Another thing we ought to keep in mind is that of the 45 million, about 11 million are either actually on Medicaid or they're eligible for Medicaid, but there's a counting problem. That's 11 million. About 9 million are not citizens of the United States. Now, it seems to me we should not feel obligated to provide a full-blown health care plan for people from other countries. I don't think that's part of our obligation. 10 million of the 45 million uninsured, 10 million or so, have incomes over 3 times the poverty level, which for a family of 4 is something on the order of $60,000 or $70,000 a year. So we ought to ask ourselves, do we need to provide a second plan for the people who are already eligible for Medicaid? Do we need to provide a plan for people who are coming here from another country? Do we need to provide a plan for people whose income is 3 times the poverty level? I would suggest we don't need that. Now, that leaves you with something like 11 million people who actually do have a problem obtaining health care. That's something on the order of 3% of our population. And that's important, and we can't ignore it, and we've got to work on that. But it's not clear to me that we should upset the system for the other 97% to solve the problems of that 3%. Okay? One last point. The bill, I believe the way the bill is written, it contemplates that that illegal immigrants would not be permitted to participate in the government plan. But it's also my understanding that there is no mechanism for enforcement. There is no requirement, for instance, that people demonstrate that they're legally documented citizens. So you might wonder how they would ever enforce that.
That was fantastic.
But there always has been a law that federal funding cannot be used for illegal immigrants. And in fact, someone brought up an amendment in one of the committees and reinforced that in this. No federal funds can ever be used for illegal immigrants. Do they go to the emergency room? Yes, they do. And you're right, there isn't an enforcement mechanism that turns them away. But there is no federal funds for the public health care plan option, and they are not to get treatment. They're not here legally. Second, however, I want to address about the uninsured. There's a lot of different studies out there. And there are about, when you add that 45 million, there's probably at least 6 or 7 million illegal immigrants in that number, at least. And there are those who could pay for their own health care plans that are in it, and some that can't. The problem is you're all paying for them anyway. According to the Institute of Medicine, if you're in a family of 4, you pay $1,100 more for your private health care plan than if there were no uninsured. That's why we have car insurance. If you get hit, you want the other guy to pay. Why are we paying for the uninsured? Those who can pay for it and don't. The young masters of the universe that think they're going to live forever. And go into the emergency room and they're acutely ill, they get taken care of, but that bill gets passed over to the insurance companies, passes on to you and me, and if you're single, you pay about $400 to cover the uninsured. Whether they deserve to be uninsured or they don't pay, either way, we're paying for it. That's why there's a mandate that everybody will have health insurance, just like there is for car insurance. Because why should we pay for them when they could pay for it? So his point's well taken. That's why the bill addresses it. Now, I want to go back to the comparative research issue. When my daughter had her brain tumor, boy, I really looked into this issue. 5 different pathologists had 5 different types of glioblastoma. It was Johns Hopkins, Mayo Clinic, CHOP in Philadelphia. And finally, one of them told me that in many parts of medicine, it's still an art, not a science. Over 50% of the treatments I found out that are being prescribed, whether it's for his father or mine, are not scientifically based. I was astonished. So comparative research, there is nothing in the bill, zero in the bill, that says there's any incentive pays for using those treatments. I repeat, zero. But what it does say is, look, why are we paying for every Medicare patient in San Francisco $8,000 per patient, but $16,000 down there in Miami? And so what it says is, can't we get more science-based types of evidence of what might be the best treatment that at least you can pick from? I wish I could have seen more. I had wonderful doctors, and I thank the Lord every day for them. And I do, sir. But I have to tell you, as one of them said, it's still an art, Joe, in many areas. We need more funding to find out and do more studies and find out what is the best treatment for your daughter and for others. That's why it's in the bill, and I strongly supported it. Thank you.
All right. I want to make sure I get somebody in the middle on this side. This young woman right behind there. How about you? Great. And sir, please introduce yourself and where you're from.
Yes, my name is Bruce Whitesell, and I'm from Springfield Township in Upper Bucks County. And I'm 59 years old. I make less than 3 times the poverty line. Okay? And I'm one of those people that falls within the 3% who are currently uninsured. My wife lost her employment last year. We had received health care benefits, wonderful health care benefits through her employer for 30-some years. Those ended as of January 1. We both have pre-existing conditions. I'm outwardly healthy. In fact, I'm not disabled. There's nothing wrong with me at this point in time. However, we're not able to get health care insurance because of those pre-existing conditions. And I appreciate the fact that a free market, okay, should in fact give us the opportunity to find insurance at competitive rates. But again, in Pennsylvania, that simply doesn't exist. It would be wonderful to create a group of people like ourselves who are uninsured and who have pre-existing conditions, and we could shop that throughout insurers throughout the United States. But I doubt very much that we'd find anybody that would be willing to touch us at this point in time. So my question to you, Mr. Toomey, and to you, Mr. Sestak, is how do you propose to take care of people like ourselves who will probably be back in the workforce sometime in the next 6 months, and our problem will go away, but our shoes will be filled by somebody else? Thank you.
Yes. Thank you for the question, and it directs us, Pat, of what Pat was talking about the those 3% or whatever the percentage is, because there's various studies on what the right numbers are. First off, no longer can insurance companies deny you coverage, any insurance company, deny you coverage for pre-existing conditions. It's just fair across the board. Second, for those that aren't able to afford it, if you qualify for Medicaid, you're in Medicaid. Then we have a sliding subsidy up to 400% of poverty level. A little less as you get higher. Now, those who are at like 150% poverty level have to pay no more, but have to pay out of their pocket 1%. And as that sliding rate gets up to where you're 400% of sliding, you get a lot less, and you have to pay at least 12% out of your pocket. It's a shared responsibility between individual, society, and an employer-based business. And that's what we tried to affect. We're all in this together, and we all have to address it. But you get to the issue that I want. People talk about bureaucrats in Washington, D.C. trying to dictate the types of treatments. None of that is in the bill. But it is in reality of what the insurance companies do. Can you get health insurance? Sir? Okay. So you're being rationed right now by the insurance companies. And so the issue here is we don't want them to make the rules, because we are a less productive society. Because of the underinsured and the uninsured, as I mentioned earlier, we lose approximately $260 billion a year in economic productivity. Measure that times 10, over $2 trillion. And we're not even adding that to the $1 trillion that people say this is costing, and it was budget neutral. So what we're trying to do, and that's why I went to Small Business Committee and Vice Chairman there, is think about small businesses. Right now, as I mentioned earlier, they're paying 18% more than a big employer because they can't spread the risk. If they have 10 people, one has, let's say, cancer, boy, their costs go way up. So we permit them, if they have less than 50 employees and a $500,000 less than payroll, not to provide health care, to let their employees choose which private health care plan they want to be in. All of them have to provide the same benefits that congressmen and women have, and there is the public health care plan option. Not a cent from the government. Subsidized by those who join. But we're not going to pay those exorbitant CEO pays. And it's going to have to survive on its own at market rates. And we begin to get the competition that says to these insurance companies who can deny it, think about it. If you've got 70% of all the private health care plans in the Philadelphia media market, 42% of the population lives, you can dictate prices. That's not fair to you. Thank you.
You know, I think I mentioned right at the beginning of my comments that I think people with pre-existing conditions often have serious issues that we've got to find ways to address, because that's a problem for some folks. There are different approaches to it. In some places, they use risk pools, where higher risk people who are likely to have higher costs, go into a pool, and there's an insurance plan that's designed for people in that category. And I think in many cases, we have to, at this point, and given the current structure of healthcare in America, we've got to find ways to subsidize those costs for many people, because it's unaffordable for people who have serious and expensive pre-existing conditions. But we should be very careful, and we should remember that when government forces mandates, and this bill is chock full of all kinds of mandates about what businesses shall and shall not do, they always have unintended consequences. Let's take, for example, the mandate that nobody can be denied coverage for pre-existing condition. I mean, that sounds appealing. But let's think about it. If that's the law of the land, why get health insurance until you absolutely need it? Why pay a dime? Because you can get sick, get hit by a car, or whatever your problem is, and they have to take you. So just wait until you have a serious health problem and then have the insurance. Now, these guys, they're not dumb. They thought of that, the guys who wrote this bill. So what they do is they'll punish you if you don't have insurance. So if you're a worker and your company doesn't provide it and you don't go out and get it, you'll be forced to pay a fine, a penalty, a tax of 2.5% of your wages. So let's do the math. Let's say a young 25-year-old guy is making $40,000 a year. 2.5% of his wages is $1,000. New Jersey happens to have the kinds of mandates that Joe's advocating in this bill be national. That worker in New Jersey has to pay almost $6,000 a year to buy insurance. Now, what's that worker going to do? Is he going to go out and buy insurance? Or is he going to just pay the $1,000 and be done with it? See, these are the unintended consequences that invariably accompany the heavy hand of government mandates. And when government comes in and says, we're just going to force you to do what we want you to do, whether you like it or not, there are always going to be some problems. This is why I think we'd be better off moving in the direction over time of individual ownership. To the gentleman, the health care problem arose, as I recall, when you lost your job. If you had an insurance plan that you owned, if it weren't through the employer, but you owned it yourself, and you had selected it from among hundreds, maybe thousands of competing plans across the country, and by the way, federal law requires that it be renewable, well, losing your job wouldn't have meant losing your insurance. So I just think we ought to move in this direction of greater personal ownership, personal control. You know, the markets do work if you let them. We've got too many laws that just don't let them.
We're coming up against the 8 o'clock hour, and the nice folks at Channel 69 are going to let us run a little bit over, but this is going to have to be our last question, so, ma'am, and then we're going to go to closing remarks. So please introduce yourself.
Hi, my name's Danielle Kabazinski. I'm from Red Lion, Pennsylvania. Thank you for coming. I'm Catholic. I believe in the sanctity of life, and I also have the honor of being a military wife. I was astounded by the fact that the administration brought back the death book for veterans. That is the insurance that, if this doesn't go through, that my husband will have and I will have. I also believe that the administration was saying that there is no money in this bill for abortion, which I found to be incorrect. What assurances can you provide to us that, be it an unborn fetus or a baby or the elderly, are going to be given the sanctity of life, that they're going to be able to have the care that they need to live?
Thank you.
I'll start by saying I agree with you on the sanctity of life. The bill has various permutations in the various committees, and so we don't really know what's going to end up being on the House floor or what, if anything, gets to the President's desk. But I can tell you I'm pretty confident that there continues to be a bipartisan majority in both houses of Congress, certainly in the House, I think. There's still a majority that believes that taxpayers shouldn't be forced to subsidize abortion under any circumstances. So I can't guarantee anything, obviously, but my guess is that when it finally comes to a final version of this bill, it's likely that there will not be taxpayer subsidies for abortion. That's my guess. Joe would have his take.
Thanks, Pat. Thanks for your service. Used to be a shopping bag in the commissary. On the Navy side, they used to say, Navy spouse, hardest job in the Navy. Thank you. There is no federal funding for abortion in this bill. In fact, one of the committees also had a vote on that to reaffirm that there was to be no federal funding for it. I want to talk about the death pamphlet. The death pamphlet in the VA, as you probably know, has been around since the mid-90s. It was on the website throughout the entire time of the Bush administration.
But they got rid of it.
And then the Obama administration was going to update it. And I've read it. I went through the whole pamphlet. And there is nothing further from the truth. All it is very much like it is in the bill, that if you choose, here is a pamphlet that will help you decide, let's say you're 79, by yourself, to decide what your living will be. And it walks you through that. It was good for 15 years, and they're thinking of updating it. And so, very similar as in our bill, what it says is, hey, if a doctor voluntarily sits down with a patient to work out a living will and who they want to take care and make decisions later on, they're reimbursed, the doctor. That's all our bill says. And so there is no death pamphlet. I'm happy to walk through that.
So the doctor gets reimbursed for volunteering?
In Medicare. See, they put it in there because it's his time. So if he gives an hour to sit down, we have to reimburse them legally for their time.
To talk through their death?
No, it's just to sit down and help them work through, do you want to make a living will or not?
Okay.
All right? If I could talk about the VA, though, if you don't mind. 32% of our National Guard, when it comes home, has post-traumatic stress disorder. There is a backlog in the VA of 600,000 disability claims. They can't even get the care that should be there. When you go to the VA, who are wonderful people, but under-resourced and have been for a long time, what you find is that what we had to do the last 2 years is actually appropriate money. Over $10 billion, the largest increase in the history of the VA. And this president actually has an 11% increase over the next 5 years, which again is the biggest increase ever in the Veterans Administration to address these health issues. Post-traumatic stress disorder. We weren't prepared for it as a nation. They're coming home in the middle of a savage recession. We welcome them home, different than Vietnam, where we kicked them to the side of the curb. But this time we'll welcome them home. But the VA needs our support because this war is different. They go outside the wire every day into a combat-like situation 24/7. Then they come home for 12, go back for 15. You're wonderful, heroic World War II veteran, went into combat 182 days on average. Horrific battles, but dwell time in between to rest their nerves and their mind. If there's a group that needs our support, it's you, the spouses and the family, and the vets. Thank you.
I agree, but there's a huge wait.
That's for Upper Darby. Thank you. I really appreciate the reception. And Pat, I'd stand on stage with you anytime. This is the electoral system I defended, and I love it. If you can't be in the Navy, this is the next best job. But I want to make sure everybody understands that it is our jobs as representatives not to be in an echo chamber down in Washington, D.C., thinking that we're explaining to people what's going on. These town halls have been representative of America. They have lost their faith in Washington, D.C. They've been placed in this savage recession through no fault of their own, and now we want to help them with their health care? I believe in this bill so strongly. It's the reason I got in. Not this specific bill, but the aspects of it that I worked hard to bring about. And we may disagree on it. But I have no doubt that at the end of this debate, that America will always do what it does and come together. Yes, Winston Churchill said it best. America eventually does the right thing after it's tried everything else. He also said this: I have great faith in the American character. What we need in the future is principled, accountable leadership. Someone who's willing to describe that maybe there isn't socialism in this. This is really capitalism, but making it more fair. We can disagree of how we do it, but it's my responsibility to be here and explain it. It's also a requirement that it shouldn't be bigger government. It should be better government. How do you do that best? Washington, D.C. should have been out and about over the last 8 months, explaining what it was up to. I appreciate this opportunity. I hope we have many more, all the way through November. And finally, if I might say, we should be very proud of Pennsylvanians. It's a commonwealth. We're pretty darn independent-minded. I mean, it's where the Whiskey Rebellion started. And you know what? We're going to make up our mind over the right type of leadership that's accountable and principled. Because if there's any danger to us, more than anything else, even health care, or the lack of an educational opportunity, or an economy that is so savage for us today, it is the loss of confidence in our leaders in Washington, D.C. That, more than anything, we must restore. Thank you.
I want to, one more time, thank Muhlenberg very much for hosting this. And Chris, thank you for doing a great job and for all that you do. And I've got to tip my hat to an audience that really participated in a great, constructive, and useful way. And Joe, thank you. I think this is the kind of discussion about health care we ought to be having all across the country. But I have to say, I understand the apprehension and in some cases the anger of people who've been coming to town halls and have been participating in maybe in different ways in this discussion. I think it comes from the cumulative effect of everything that we're seeing in Washington. Serial bailouts of failing companies, nationalizing whole industries, spending on a level, on a scale we've never even imagined, deficits and debt that we've never created in the past, whole new taxes on everything, new taxes on income, on wages, on business, on capital. An effort to totally impose new regulation and new taxes on energy. And now along comes this huge government intrusion in health care, and a lot of Americans said, wait a minute. This is starting to look like almost a little bit like a different country. And that's got a lot of people concerned. So, I will never for a minute fail to be conscious of the fact that our country, this this great country that the rest of the world calls America and we get to call home, went from being a third world colonial backwater to the richest, most powerful, most wonderful, most prosperous force for good on this planet in the history of the planet. And we did it in a few short decades. We didn't do it by believing the government was the answer to all of our problems. We did it.
Yes, folks.
Thank you. We did it by believing in us. We believed in limited government and personal freedom and personal responsibility and a free enterprise system. And folks, we need to address the flaws in our current healthcare system, but we can do it. We can do it with a free enterprise system. We can do it by opening up more competition. We can do it by empowering individuals and families to own and control their own health care so that they've got the flexibility to make the decisions that are best for them, because I've always been convinced that a mom and dad sitting at a kitchen table make better decisions for their family than any bureaucrat ever can or will. So I want to thank you. I want to thank you for being here today, but I also really want to thank you for being engaged. The Washington establishment has heard a message this summer, and I think it's a very constructive message. Thank you very much.
Thank you. Thank you.